So again, we're the Beauty Bus Foundation. We provide beauty and grooming services for people that are homebound with terminal and chronic illness. People can become very, very isolated in their illness. And it takes all of what you have just to get through the day. They leave their homes for doctor's appointments. They're constantly getting tests taken. It's very, very draining. And so to be able to go to them, take care of all the scheduling and everything, and just let them enjoy being pampered, it's very, very special and so important to their recovery and to maintain, their psyche and their happiness. So it's really something special. We serve men, women, and children. Our youngest client is 4, the oldest is 101. So we're all over the place, and it's really something great. I'm going to tell you a little bit about how we were founded. So our founders are a cousin and sister team, Alicia and Wendy. So basically what happened was they lost their cousin and sister to a degenerative neuromuscular disorder. She was 27 when she was diagnosed and passed away 11 short months later. I never had the opportunity to meet her, but Melissa was described as a spunky redhead who really loved a great day at the salon. And so as she got sicker and her illness progressed, she was unable to leave the home, obviously, and Alicia, who was a beauty editor, was able to use her connections in the industry to set her up with some appointments, and they just said it made her feel human again and just brought a real smile to her face. And so they wanted to bring the same touch of pampering to other people going through similar conditions. We were founded. Our symbol is obviously the bus and a butterfly. Now the butterfly is a symbol of Melissa, and that's how her mother sees her now as something that is free and beautiful. So we have pins for all of our volunteers, and we give them t-shirts and ask them to wear it with pride. So you'll see a lot of that if you sign on with us. We have been around for 4 years now, and there's 5 staff members who pretty much do a little bit of everything, being a small nonprofit. So it's busy and very, very quickly progressing. So it's really great to see. So essentially we have 3 main programs I want to tell you about. Our in-home services are pretty much the core of what we do. Again, we service all of LA County, and we're currently moving into Orange and Ventura counties. And that is essentially sending 2 volunteers into the home of our clients to give them their service. The second are pop-up salons, and they are a really great kind of community event. And that's where we essentially partner with something like a cancer center, an ALS walk. We go into Mattel Children's Hospital, City of Hope, Ronald McDonald houses, and basically we take whatever space they can get, even if it's the size of this room, and we make a salon for the day. We have a number of nail technicians, hairstylists, makeup artists, and they are there to basically be there and let all the patients come down with their caregivers and just have a break from being in the hospital and from being sick. On one such occasion, we had somebody come down, and she was in the intensive care unit with her young child who had cancer, and she said, I can't even leave the hospital. I can't even have time to wash my hair. My hair is falling out. And she went in there kind of with her head down, and when she came out, it was like a new person. She was swinging her hair, and how amazing is this? And you can just see the transformation of people. I'm sure you guys see it all the time, just the regular population coming into your chair and what a good manicure or haircut can do for you. So you can imagine when you're going through something as challenging as that, how wonderful it feels. Is our Bag of Beauty program, and that is where we send bags of donated product to clients who would normally qualify for our services, but don't because they live outside of our service area. We send them these bags of product just to remind them to look and feel great and give them a little bit of pampering from afar. And we're doing that, obviously, like I said, nationally. Our pop-up salon program is also a national program. We did our first pop-up salon in Las Vegas last summer at Cosmoprof, and it'll be happening again this summer. And actually, just this past weekend, I got off the plane last night at 7:30, and we went to Chicago, partnered with the ALS Association of Chicago, and had a pop-up salon there. So we did around 91 services for people affected by ALS, and some volunteers helping out there. So it was really, really something special. And basically there's also 3 ways to volunteer with us. We have opportunities for beauty professionals such as yourselves to join us and actually give us services. You can either sign up to be part of our in-home program or a pop-up salon program. or both, which usually that's what happens. People do that. And the in-home program, we actually offer compensation, so that's something to consider too. It's a really great way to cover your gas money, but still give back and everything like that. So our second volunteer program, is for our beauty buddies, we call them. They're non-licensed professionals who attend both the pop-up salons and the in-home services, and they are there just to bring a bit of a compassionate touch and help the professional however they can, just be a companion for the person getting their treatment and keep it kind of like a salon experience. And then we have our ambassadors. Our ambassadors help out at special events, and they also come into the office and help out with a number of things, such as inventory to data entry to answering phone calls. So we offer a number of services to our clients. We do haircuts, hairstyling, and blow drying. We do manicures and pedicures, makeup application, facial treatments, face painting for kids, and we also do electric shave for men. A lot of our professionals choose maybe just one avenue, some do all, depending on what you feel comfortable doing and everything. And basically we provide 2 services per in-home visit, and we try and do as many services at a pop-up salon as possible for a client, just trying to get everybody seen at the same time. We don't dye or wash hair, we don't do waxing or threading, and we also don't do full body massage. This is due to a lot of mobility issues our clients may have. They may not be able to lean their head back in a sink. There's some movement issues for some of our conditions that we serve, and that may be harmful if we maybe were to use a straight edge razor or something of that nature. So our limitations are strictly due to safety issues. And in terms of whom we serve 7 diseases in total, the last one being a little bit broad. So we do serve people going through ALS, people that are going through cancer treatment, muscular dystrophy, Parkinson's disease, multiple sclerosis, stroke survivors, those with spinal cord injuries, and other select neuromuscular and motor neuron diseases. There are over 42 in that category, so I won't bore you and go through all of them, but that category is a little bit different. And then for caregivers, that was brought on because they give so much of themselves, and they are sometimes not recognized. These people, we've run that numerous stats where they sometimes end up themselves getting sick because taking care of themselves. They are, maybe not exercising or eating, and there's a lot of different factors that go into those physical and emotional symptoms. So we want to give them a little bit of care, and we even have something that we call the lipstick challenge for caregivers, and that's where we challenge them to take 5 minutes, put some lipstick on, and feel good about yourself, because you can't give really good service unless you're yourself feeling good. So we like to stress that a lot. So besides beauty and grooming services, a lot of what we do is to provide the compassion and the compassionate touch and companionship for people that are homebound with different conditions. People, again, can become very, very isolated in their illness, and it's really important that we act as a liaison to the outside world. And even if you're going in there and every visit is different and every visit is special, and it's just, even if you're going in there, again, talking about a stupid movie that you saw or about the weather, it's just really nice to have somebody in the room and just a fresh breath of air. One such instance, when I first started, I went on an in-home visit as the buddy, and I was there and there wasn't a lot of conversation, and I spoke to my mother afterwards, and I said, I don't know that I really did much, and I kind of felt useless as the professional was doing her thing, and she actually lost her sister to a brain tumor, and she said that, as her sister got more and more sick, less people started to come because it was hard for them to see her like that, and as the weeks progressed, it was less and less visitors. So even to have somebody come in for an hour and just sit by her bed and hold her hand is just really a big relief. So it's so important what we're doing, and we really hope that you guys can be a part of it. And again, thank you so much for your time. Are there any questions at all about what we do? Or
yeah. Who sponsors your company?
We're again nonprofit, and we're founded by private donations and grants. Yeah.
And hospitals freely allow you to go in? Is it a big process to
It depends. There are some stipulations. Again, that's on a case-by-case basis, but it's kind of at the beginning it was us contacting them, and now some of them contact us and just see how, they can get our services there. For instance, the Mattel Children's Hospital is maybe a little bit more strict because, it being children with, weakened immune systems, they really want to protect them and keep everything very sanitary. So if we do a pop-up salon, for instance, we will bring a whole bunch of, single-use makeup applicators, little samples, and we will leave it with the client just so that we're not, cross-contaminating and things like that. So it's kind of how that works.
If a graduate or a cosmetologist would like to work with you, what do they have to do?
So in order to be, you can be a part of what we do, you can always check our website. We're www.beautyboss.org, and you'll see a link to volunteer, and we have our application form there. You're welcome also to email us or call us anytime. It's 310-392-0900 or beauty@beautyboss.org, and we're happy to answer any questions or, send you our application form. As a professional, we do, again, require our professionals to be licensed and have their license up to date, and we will be asking for the license number and be checking it. We also ask all of our volunteers to submit a background check, and that's just because you are going to people's homes and it's a vulnerable population, and we just want everybody to be very safe and everything. And we also, again, require the application form and a copy of a driver's license. So that's kind of our application process.
What area do you serve, or how
we
broad?
serve all of LA County. We're currently moving into Orange and Ventura as well. So
Okay.
we have a client way up in Oxnard, down to Long Beach right now. We're just always looking to expand. So. Any more questions at all? Is there one over here?
I'm sorry, so the cosmetologists that are working with you are volunteering their time, or are they getting paid?
So in the start, it was all volunteer work, and then in March of this year, we began offering compensation to our for our in-home services. So the pop-up salons, which are more of a group experience, they are all volunteer, and then professionals can opt to receive compensation for their time for in-home services. Not everybody does, some people do. So it's completely up to the professional how they would like to do that. We just give them an invoice form and they send it back if they would
So
like
they
to.
bill you?
Yes, exactly, yes, yeah.
And is there like a certain price structure?
Yes, we do have a certain structure, yes, yeah. For each different service, it's a different compensation amount, yes. Yeah. And then we also compensate per service as opposed to per visit. So if you're going to go and give, 2 pedicures, then that's a different payment than if it was just going to be 1 facial, for example. So.
Do the clients in home, do they pay?
No, all of our services are free of charge to our clients, and we offer 12 in a 12-month period, so someone could get something done every month if that was set up.
If you want to be a client, you will have to show that you're sick.
Yes, so in order to be a client, we have 3 different forms. One gives us permission to have their health records in our files. The other is an application form just with all their contact information and whether or not they have pets in the home or they smoke in the home. Because again, we want this to be a really good experience for you guys and for them, and you will always know kind of what kind of situation you're getting into, and you can opt out if perhaps you have allergies or something of that nature. And then the third form that they need to fill in is a doctor's release, and that needs to be signed by a doctor or registered nurse, and that's just stating that any of the services that we provide will not cause the client any harm. So that's
And if I'm a client, can I use your service every week?
it's 12 in a 12-month period. So
Once in 12 months?
no, so you can have 12 in a year. And
Once a
however,
month.
that's
Oh,
just
12
yes.
a year.
Exactly.
Once.
I have a question. And if you're not licensed, you can't do the service?
No, but that being said, for our pop-up salons, we have had student groups in. The one we did this week in Chicago, we actually had a student group that was doing the nails, and we just need to have the licensed instructor there kind of overseeing everything. But as long as they have completed more than half of their hours, so half of their schooling, then they can come help out in the pop-up salon situation, but not in home services.
So in your website, you have the schedule. If anybody would like to volunteer, they can just contact you.
Yes, certainly, yes. And we have monthly training sessions, and they're normally at our office in Santa Monica, but we also will do the odd one in the Valley too, so that's an option. And if there are groups of 5 or more people interested, we can come out and do a private training session as well, in whatever location is most convenient for the groups.
If they would like a letter of recommendation or something like that, it's something that they could put in their resume.
Certainly, yeah.
You will
Oh,
you will
yes,
provide,
and,
yeah.
We can, give a list of their hours and everything like that. So.
Perfect.
And we don't expect our volunteers to travel in excess of 5 miles from their home or where they go to school or where they work. So you can completely say, I only want to stay up in the valley, or I want to be on the west side. So whatever works for you, we can work with that.
Thank you so much.
Thank you for your time.
Those are the people with those diseases that could be served for free.